Hi there. This is a question for Dr. Pedati. What, in your mind, makes you think that a sort of patchwork opening where some counties are open, some aren't, will work for Iowa, will work to keep the disease from spreading?
Well, I'm going to start with that, and then I'll hand it over to Dr. Pedati. But it's based on a stabilization, and it's based on virus activity and the amount of new cases over the past 14 days. So, we're going to continue to look, and because of the tools, the additional tools that we have, we are now able to really drill down and look at the virus activity from a state perspective, from a regional perspective, to a community perspective, and eventually right down to the zip code. So again, we can start to identify early where we might see some clusters or some outbreaks, and so we can address that in a quicker manner. And so, there were, as I said earlier too, there are 15 counties that have had no activity whatsoever. And so they are at a place where we can start to, in a very responsible and safe manner, start to open up the counties and start to open up the state. And I have confidence in Iowans that they are going to continue to be a part of this solution. They're going to continue to do the right thing, and we're going to continue to see, hopefully, positive signs of that, and we'll be able to continue to build on what we're already doing.
Thank you. So again, I think that what's important is to understand the overall public health approach to managing an outbreak as well as to disease management. So when we talk about working on outbreaks, and as I've said before, we're doing a lot of things all at once. We're collecting information, we're orienting it by time and place to understand and characterize trends at a variety of geographic levels. We're making sure that we understand who people are who are at highest risk and how we can protect our most vulnerable populations. And we're implementing the control measures that help us to limit the spread of something, which again, as we understand more about this virus, and we still have more to learn, but what we do know again is that this is spread from one person to the next when they're in close contact with each other, which is similar to what we've seen from other types of respiratory pathogens. And like other respiratory pathogens, we often see differences in regions, particularly around populations or places where people gather, so congregate settings. And so again, we use the information we have so far and what we know about the virus and how it behaves. We integrate that with what we know about who's at highest risk, and that helps us to drive our control measures, which we're able to do at varying levels in more targeted ways as we gather additional tools and resources. And it's again an example of a place where I think public health in general remains flexible as we get more information and more of these tools and resources, and we're going to continue to adjust just like we would with a flu season or any other illness that public health professionals work to protect Iowans against.